Today, I've got a couple of cheeky chaps in for some cheek fillers. Hi guys, my name's Dr Sarah Tonks. I'm a cosmetic physician in London. I know you guys love looking at good-looking young men, so I've got a couple for you today. What a treat. And following in the theme of the previous few weeks' videos, we did lip fillers and we've also done Botox as well. Over the next two videos, I'm going to be looking at purely cheek fillers on their own. And this is really just so that you guys can identify, if I do a mil of cheek filler, what is it going to look like? Is it going to make me look really weird, you know, with cheekbones like out here or something like that? Obviously the answer is no, and I'm going to show you what it does look like. So we've got our first patient here today. Lovely looking young man. He's got a bit of facial discrepancy, as you can see. He is much more full over on this side than he is over on the other side. And he just wanted to have a bit more of a cheekbone pop. I mean, I think his cheekbones were pretty popping in the first place, but you know, you got to start somewhere, I guess. If I wasn't just going to do that, and if I was going to do the whole kit and caboodle for him, what would I do? Well, you can see that he has got quite a substantial amount of volume loss here in comparison with the other side. And you can also see that the width of the jaw, this is not, by the way, the head tilt, this is just what his face looks like. There is some asymmetry, is quite a lot wider here than we have on this side. What to do? So in the spirit of just showing you guys what it looks like when somebody has cheek fillers done, here I am injecting him with 1 ml of Juvederm Voluma on each side of the face, just on the cheekbone. That's it. Look at this. Check it out. And now here we've got the before and after. Voila. I did put a wee bit extra right here to try and make him look a tiny bit more symmetrical. And you can see that this sort of whole area there now looks a bit more congruent instead of looking flat like it did before. It's just because of the position that I put the filler into. And that's it really. You can see that the change is pretty subtle. So when I say to people, we're going to need to put like 12 mils in, it always sounds like an awful lot of filler, like I'm suggesting, you know, major surgery or something like that. It's really not. A ketchup packet is like 10 mils. So really 12 is not that much. And you can see that with 2, it does something, but it's a very, very minor, subtle change. So guys, if your doctor suggests to you, I think we need to use 3 or 4 syringes here, there's probably a good reason for it. Let's just have a quick look at him smiling. There he is. You can see that there is a little bit more, as I said, congruence in the cheek here in comparison with the before. People often worry, are they going to look like themselves after they've had cheek fillers, or is it going to make them look a bit chipmunky? It all depends on how the filler's done, guys. If it's placed over the top of the muscle, it can move when you're smiling. Well, if it's placed over the top of the muscle in this area anyway, it can move when you're smiling, and yes, that can make you look weird, so it has to be put underneath. That's it. On to the next chap. Okay, we've got our next chap here. Let's have a cheeky look at him. What would we do if we were doing everything? Well, it's a bit of facial asymmetry. This cheekbone, not as good as the other one. I'd probably raise his eyebrow a bit on this side as well. And I think he could do with maybe a bit of lip filler. What do you reckon? I can really see those lips being a bit bigger. Not that big. That would be ridiculous. Okay, I'm just going to get rid of that. And the angle of the jaw looks a bit different on both sides. So you can see it's nice and defined here, and here it's a bit sort of meh. So I would sculpt that a little more like so. What did we actually do? Exactly what I said we were going to do. So we just put 1 ml of cheek filler on each side. Let's take a look. I'm just injecting, again, Juvederm Voluma onto the cheek. I stole a bit from the right side to put it in the left because he's really got a bit of discrepancy there, and I'm putting a bit more into the left side anterior cheek. And let's have a look at him. Again, not rocket science, guys. You can see, because I've added a bit more over on this side than on the other, his symmetry is a wee bit better than it used to be. Love to get my hands on that jawline at some point. And let's have a little look at him smiling. Looks normal. Guys, just because you have cheek filler doesn't mean you're gonna look weird, yeah?